The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. My question is for the Premier. Yesterday, our caucus learned from officials in the Department of Health and Wellness that the amount that the government had brought in last year from patients for ambulance services was $14.3 million. I would like to ask the Premier, does he think it is fitting or appropriate in our universal health care system, in our public health care system, that the government should be collecting over $14 million in user fees from people in urgent, distressing medical situations?
The Honourable Premier.
Thank you, Mr. Speaker. And our EMS service has been doing well over the last number of decades, a pioneer service in North America. There is a Fitch report that looks at ways that we can make that service more efficient, utilizing staff more appropriately, Mr. Speaker, improving offload times. That's the work that's underway. We're going to continue to look at the recommendations, most of which are already in implementation, but we're going to look at that report very closely to ensure that we are remaining cutting edge in the country.
The Honourable Leader of the New Democratic Party.
What I am asking about specifically, Mr. Speaker, is the financial consideration from the point of view of patients. Now, recently, the government reported that last year, the Department of Health and Wellness had written off debts as uncollectible in the amount of $4.7 million, and that a significant component of those uncollectible debts were uncollectible bills that had been sent out for ambulance services. Now, doesn't it indicate, when we see that such a high percentage of the bills that have been sent out in the province for ambulance services in a year have proven to be uncollectible, doesn't that indicate that those bills are being sent out to patients in the first place who can't afford them?
The Honourable Premier.
Thank you, Mr. Speaker, and I want to thank those healthcare workers that continue to provide cutting-edge service to Nova Scotians, one that we should be always looking for continuous improvement on. There are programs that help support low-income Nova Scotians. Low-income Nova Scotians actually do have an opportunity to get that fee that the member opposite referenced waived. Thank you, Mr. Speaker.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. What the Premier has said is, of course, the case, but it is also the case, and I will table the source of this, that 23% of people in our region report that in the past they have made the decision not to call an ambulance in a situation where they otherwise would have made that call because of financial considerations. Now, surely there are many situations where this has a negative effect in terms of delaying treatments or where it has a negative effect from the point of view of conditions worsening. So doesn't the Premier agree that in moments of distress and 911 urgency that people shouldn't have to be weighed down with considerations about the money in the bill?
The Honourable Premier.
Thank you, Mr. Speaker, and people should not have to worry about financial considerations when it comes to health care. That's why we do have the ambulance fee waiver program for those that are in low income, Mr. Speaker. We'll continue to make sure that we're looking at that program to ensure that the income cutoff is at an appropriate level, and I'll make sure that I take that back and have a look at the program. Thank you.